There we go. Okay. Okay. So the musculoskeletal system. Now, of course, you don't have to learn all the bones and all the 600 muscles, but it is always cool to try and figure out a little bit of what's connected to each other. So the system that we're studying today consists of the muscles, the bones, the bone marrow, the joints, cartilage, tendons, ligaments, and bursae. Okay, so you've probably all know that the human skeleton contains 206 bones, but I don't think as many people know that there's more than 600 muscles, which is just mind blowing when you think of all the things that work right on us every day. If we had two muscles that didn't work right, we'd be in a pickle. Joints are where two or more bones meet, and it contains both cartilage and bursa at the joints. Okay. So the function of musculoskeletal system, we all know that it's for movement. It's to keep us upright, our posture, to keep our joints stable, and to produce heat. Um, it provides a framework, and most importantly, I think it protects the soft parts of our body, especially our brain. The bones store calcium. Um, they support and protect the bone marrow, which we, of course, take for granted because that's where blood cells are produced. And the organs and structures of the musculoskeletal system work together. Not only do they protect and support, but they help us move. So, of course, the, the different views are going to give you different bones. So when we look at our body from the front in the anterior view, we get a lot more bones than if we look at it from the posterior view. I always say the most protected parts are in our head and in our upper torso. Okay, so you can obviously see by looking at these two creepy skeletons that the brain is protected by the cranium and the nasal bone and the maxilla and the mandible and the orbital bone. And the ribs protect the lungs and the heart, which are the two most important organs. So the design is good, but when something goes wrong with the design, it can get a little tricky. So the skeletal bones in the head, okay? We have the maxilla, which is our upper jawbone. Okay, I liken that it's the bone that you can touch between your nose and below your sinus. Okay, the mandible is the lower jawbone. So when someone breaks their jaw, usually it's the jawbone. That's the thing that helps us open and close our mouth. Okay, the orbital bones, they're basically the bones that surround our eyes. So the way that is set up, they only protect half of our eyes. You know, they don't protect our eyes that are exposed to the air, but it does protect mostly the inside of the eye and the optic nerve. And the cranium, of course, one of the most important bones. It is not solid when we are born. It takes a while for the cranium bones to fuse because as kids grow, they need to have room for the bones to expand. And that's why babies and another reason that the bones aren't fused at birth is they kind of slide over each other and help the baby come through the birth canal a little bit bigger or a little bit easier, I should say. So the cranium bones don't fuse completely until the baby or the toddler gets a little bit older and the brain is their full size. So this is just a picture of the knee joint. I put this on there because there's so much talk about knees. And you can see, we would usually just think of it as our tibia and our fibia and the kneecap. But there are so many different muscles and ligaments and different bursa and cartilage. The point of the bursa anywhere in a joint is they are fluid-filled sacs which help cushion things. So they can get inflamed very easily. and they can be, you know, a big part of why our joints hurt. But this is a healthy, normal knee. But you can see how when our knees hurt, it could be any number of 20 things that are listed here on the diagram. So we have three types of muscles. Okay, we have skeletal muscles, and they're striated. Um, these attach bones to tendons. Okay, so this is what makes our body movements possible, like our gross movements, what we choose to do. Okay, skeletal muscles produce action by pulling, and they work in pairs. So for every muscle that extends your arm, there's a muscle that helps pull it back in. They're also known as voluntary because we have control over them. Smooth muscle, okay, these are our involuntary muscles, okay? We don't control them. The autonomic nervous system controls them. They are located for all of our internal organs, such as the walls of blood vessels, the digestive tract, everything that we do every day that we take for granted, our heart beating, our lungs pumping, breathing, our digestive system, anything we don't have to think about that our body just takes care of is considered smooth muscle, which is awesome. I like that I don't have to think about those. And cardiac muscle forms most of the heart wall. Okay, there is some striated, some smooth. I knew I was going to say that wrong. Some smooth muscle, but most of it is cardiac muscle. Okay, and this is involuntary muscle also, and this is what causes the heart to contract. So it's good that it's involuntary and we don't have to think about it. So those are the three types of muscles we have in our body. So we've talked about these prefixes in numerous chapters, but they, of course, are very pertinent to this skeletal system. So inter is between. Okay, and I stress this constantly. Inter is between. Intra, I-N-T-R-A, is within. Supra means above, and both sim and sin mean either together or joined. Okay, asthenia is usually referred to weakness, okay? So if we have muscle weakness, it would be myasthenia. Surgical fixation or fusion is desis. Physis means growth, okay? Schisis means a split or a fissure, and trophy means normal development or nourishment. So when a tissue atrophies, it is not getting normal nourishment and it is not developing correctly. So atrophy is a term we use a lot of times in our older population. Their skin will atrophy. It's not getting the proper nourishment. Their movement atrophies, that type of thing. Okay. A means without, trophy means nourishment, so they are without proper nourishment. So again, we go back to the normal joint and for the knee, and I use this because I really like how it shows. It shows the top bone is the femur, the bottom bone is the tibia. Okay, it shows that there is a synovial membrane in there, and that's kind of the reddish, pinkish stuff that's in between the bones. It shows there's a joint capsule, which is the blue area. That's kind of a cartilaginous material that just holds it all in place. And then there's also cartilage that is on the outside of each bone. Okay, so you can see on the right hand side the black area between the two bones, where the two bones meet, and you do not get to see the joint capsule or the cartilage because they are soft tissue, and soft tissue does not show up on x-rays. So if they are, the first thing they're going to do when someone comes in with a problem is they do an x-ray. Okay, if the bones look good, there's no breaks, there's no movement, then they know it has something to do with the cartilage or the joint capsule. Does that make sense to everybody? That's why they always do an x-ray first, because that's the easiest thing for them to see. The picture on the right of the x-ray is not a happy joint. Okay, this is a knee where it is the bone is grinding on bone. Okay, so there is been a degeneration of the cartilage. Okay, there is basically no synovial gap in there. Okay, and then over on the left, this is just a picture of what different kinds of things can happen. Okay, you can get bony cysts, you can get the cartilage thins as we get older, it tends to degenerate. That's why most people that need knee replacements aren't in their 30s, they're in their 50s, 60s, or 70s. The x-ray on the right, this is a dislocated kneecap. Okay, so the whole bone has shifted over, and obviously we can see that it's not aligned the way it needs to be. Okay, and when that happens, it becomes prime then for arthritis later in life. So what rheumatoid arthritis would look like in a knee joint is the picture on the left. Okay, the articular cartilage very thin, the bone starts wasting away, but the biggest thing is there's inflammation in the tissue, and it's that inflammation which causes the pain in the joint. So you can have rheumatoid arthritis in many, many, many different joints, your elbow, your hands, your knees, your feet. The big thing is everything starts to degenerate, but then the tissue between them starts to become inflamed, and that's why it is so painful. Okay, so now we're going to switch to uric acid. Uric acid is it is a normal substance that we have in our body, but when you have too much of it, okay, it causes a condition called gout. Okay, gout is usually in the feet, but it can be other areas. It causes crystals to form, and one of the big areas is the joint at the base of the big toe. And so gout, people who have gout usually have a hard time walking. They have a hard time putting shoes on, that type of thing. Okay. So now we're going to get into a few of the diseases. So Lyme disease. Lyme disease is caused by a deer tick. Okay. The figure A is the bullseye rash. And if you see this rash and the doctor sees it, they confirm that you've gotten Lyme's disease. They will put you on prophylactic antibiotics. If we can catch it very early, we don't see a lot of the complications, okay? If it is not caught early, then it invokes an immune response that can mimic very severe musculoskeletal diseases. People it will mimic rheumatoid arthritis. They will say their joints just ache. It can cause some neurological issues. So if you ever suspect that you have been bit by a tick, okay, or you see this rash on you or somebody, go and get a course of antibiotics. If you get the antibiotics, you never have the secondary issues that come up with it. These are what bones look like, the cross sections of bones. So there are 3 abnormal conditions of bones, okay? The bone A and B picture, the ones on the left, those are what normal bones look like. You know, all of our bones have holes in them, but what happens in picture C is when the holes get too big. In picture A, like I said before, the bone on the left is healthy, but that same bone on the right is obviously shrunken. Okay. So osteomyelitis, osteo means bone, okay? Myelitis means infection. So bones can get infected. They don't get infected usually very normally, okay? They can be infected post-surgical, post-injury, that type of thing, but it's not like if you get a strep infection or a staph infection, it's gonna go to your bone. Usually there has to be some type of injury or trauma, and the trauma can be surgery, okay? Whereas osteoporosis, this means the bones are very brittle and fragile. Porosis means very brittle, very fragile, okay? Malacia, if you remember from a couple chapters ago, that means softening, okay? And soft bones aren't any good either because they don't hold us up together and they're not strong. So injury can occur to any of these bones, whether it's infected, whether it's brittle and fragile, or whether it's soft. This can result in falls. This can result in someone breaking a bone in their hand just by lifting a coffee cup, okay? Speaking of which, let me have a drink of coffee here. Okay, some other terms. Kyphosis. That refers to hunchback or humpback. Okay, that's a position of the spine, whereas lordosis is swayback of the spine. Rachis is spina bifida. Okay, spina bifida is when you are born and the skin has not closed over the back of your spinal cord. A bunion, okay, bunions on the feet. The technical term is hallux valgus. A heel spur or an ankle spur or an elbow spur, something like that, can be called an exostosis. And herniated discs, you hear a lot of different terms for herniated disc. You'll hear a slip disc, a ruptured disc, a herniated intervertebral disc, a herniated nucleus, pulposus. But when it all comes down to it, they all still mean a herniated disc. So this is an abnormal curve. So this is scoliosis. This is when the spine slides to one side, okay? Whereas if we go back to the previous slide, hunchback or humpback means it's like the spine curves like a C from front to back. Lordosis means it curves like an inverted C, or I always say it looks like a pregnant woman belly. Okay, so that's lordosis. Kyphosis means the curve is in the back, and scoliosis means the curve goes side to side. They can fix these things very easily. This is one of the things that they check at pediatric visits every year, so that if there is a direction of the spine that is not normal, if it has an abnormal curve, they can do exercises, they can provide back braces so that the spine does literally straighten itself up, and that causes proper development in the future, which prevents a lot of damage. You know, there's a lot of nerves in our body. They're very integrated into the musculoskeletal system. So when you hear of carpal tunnel syndrome, it is the medium nerve in the base of the hand. And as you can see with the hand, there are lots of different ligaments in the hand, okay? But when those ligaments get out of place and the bones get out of place from repetitive motion, from working in a factory, from typing too much, from, I don't know if it's from texting too much, but you know, sometimes my hands will hurt if I'm using my phone too much. What it causes, anything that's out of whack, be it a muscle, be it a bone, that can pinch that medial nerve, causes carpal tunnel syndrome. I just want to quick see who else is here. Oh, lots of people came on. Anytime you hear the word Colles fracture, that just means a fracture of the wrist. Okay, it means where the radius meets the hand, and it is very common in elderly people when they fall because their hands go out to brace them when they're coming down. So a Colles fracture is very common in elderly people. Colles fractures are very common after snowstorms when people fall on the ice. Okay. A discectomy means that literally we are cutting into the disc. So it can be a partial discectomy. So this is a picture of a vertebrae with the disc. The disc is the blue area in between on the picture on the left, okay? Sometimes discs can be replaced. Sometimes they're damaged. Sometimes they're diseased. So they can literally take the disc out, see if it's completely damaged or only partially damaged, or they can maybe put an artificial disc in. Or if the disc is too badly damaged, they may take the disc out and then fuse those two vertebrae together, okay? You know, they try to avoid the spinal cord by all means, okay? But they can sometimes salvage the disc by just taking the damaged part out of it. But sometimes they just have to completely remove it. They are coming out with lots of neat new artificial discs. They've been on the market for about 10 years. So we are having good initial outcomes with it, but when something's only been on the market for about 10 years, I usually say I like to have 20 years of medical history under their belt before it goes into my body. But, you know, if you're desperate, if your back hurts bad enough and they can offer you this, it provides a lot of relief to a lot of people because there's no bone on bone rubbing them. So the surgery to relieve pressure on a nerve root in the lower spine is called a laminectomy, okay? So if the nerve roots are being pushed on, okay, they can take that disc out, okay, and basically I shouldn't say they take it out. They can fuse it to the one above it and provide a little bit more room. If they provide a little bit more room, usually the nerve regenerates and it's not pinched, so it's no longer hurting someone. Of course, in the musculoskeletal system, we do a lot of diagnostic imaging. An arthrogram or arthrography, that is when they put a dye into your muscle. Remember, muscles are soft tissue, so they don't show up on any type of imaging. So they add a dye to it. It's a contrast dye, and they can take pictures of it. They can do x-rays, they can do ultrasounds, and it shows the damage. The tissues take up the dye, and they can determine tears. They can determine complete tears, partial tears. They can determine if there's not enough room for the muscle, if it's being pinched by something. Endoscopy can be used where they go in with tiny little instruments with little eyes on the end, and they can go in and physically look at it. An electromyogram, okay, that is when they purposely stimulate the nerves to see if there is any muscle movement. Electromyograms are used during brain surgery. They are used during artificial limb implantation. They are used to see which nerves are working and which nerves are not working. So this is an example of a word that's not built from parts, okay? Prosthesis, okay? A prosthesis just means a replacement, okay? So this would be a total knee prosthesis or a total knee replacement, okay? And as you can see, they shave off part of the bottom bone and put the new part of the knee in, they shave part of the top bone off and put new part of and they put an artificial cartilaginous basically cushion between the two of them. So we have great success with knee replacement. Which specialist would this patient see? Now, medical management for a chronic osteoarthritic condition of the hip, okay, that person would probably see a rheumatologist, okay, because they're having trouble with their joints, okay? So if someone had a surgical hip resurfacing, okay, they're going to see an orthopedic doctor. So this is what it looks like when they redo the top part of the ball, which is kind of like a round bone that keeps your hip moving in all different directions, which makes your leg move in different directions. So the person over here on the left, you can see their hip has been very damaged. So when they went to surgery, they took the damaged part out, okay, and put a fake part in. And so they were granted a lot of relief when they do that. So rheumatologists do a lot of referring to orthopedic doctors. So there's a lot of different musculoskeletal doctors. Okay, so I like this slide because it goes over what each one of them does. Okay, so a podiatrist specializes in just feet. Okay, they treat feet, they operate on feet, they just specialize basically on the foot, and some of them do the ankle too. Okay, whereas a chiropractor, okay, a chiropractor is a specialist in treatment of the vertebral column. So chiropractors are allowed to order tests, they're allowed to order x-rays, they're allowed to order, you know, any test, any joint test, anything like that. But chiropractors are not permitted to do surgery, and they are not permitted to do steroid shots into joints, okay? An orthopedist is a physician who specializes in the study of and treatment of diseases and abnormalities of the musculoskeletal system. So if you break something and it needs surgery, that's when you see an orthopedist, okay? Those would be the doctors that are at OIP and OSS in our area. An orthotist, okay, is not a physician, okay, but these are the people who specialize in making and fitting orthotic appliances. And it can be something as simple as arch supports in your shoes, and it can be, they can help you with canes, they can help you with different shoes, artificial arms, braces, anything that will support, align, or prevent or correct a deformity, okay? An osteopath, I get a lot of questions about this. What's the difference between a medical doctor and a doctor of osteopathy? Not a whole lot, okay? But an osteopath is a physician who specializes in the system of medicine that uses the usual forms of diagnosis and treatment, but he places greater emphasis on the relation between the body, organs, and musculoskeletal system, okay? These doctors will try manipulation, they will try physical therapy a lot sooner, but there's not a lot of difference between an osteopathic doctor and a medical doctor. And a rheumatologist is a medical doctor who specializes in the study and treatment of musculoskeletal disorders that are caused by inflammation and degeneration of structures. So if people have bad arthritis, they tend to go there. People with autoimmune diseases tend to see a rheumatologist. So I had talked earlier that anytime you have a muscle in the body, there are two of them that work together. You know, and these are the different types of body movements. So we have one, when we're standing, we have one muscle that allows our knee to lift our foot off the ground, okay? And that is flexion. And then to extend the knee back to the ground, okay, we have the pear muscle, okay? So pronation means you're face down. So in this picture, the hand is face down, okay? Whereas supination, the hand is face up, okay? Again, anytime the muscles for pronation and supination, they work hand in hand. So there's a muscle that allows your arm to go out to the side in the form of abduction, and then its pair muscle brings it back into the body, and that's the adduction motion, okay? Eversion allows our foot to go one way, and inversion allows it to come in the other way. So you'll find when you break an ankle, it'll be an eversion break or an inversion break, depending on which muscles and ligaments are strained and which bones are broken. Even rotating your head has a pair of muscles which work together. So anytime the body moves, one muscle gets the body part there, and another muscle brings it back to the normal position. Okay, so we're going to do a case study filled with abbreviations, okay? And this is a picture of the hand, I believe. Yep, the R is the radius, and the U is the ulna, okay? So this is where the ulna has broken, okay? So anytime that we see a broken bone, the abbreviation is FX, or fracture, okay? All right, so this chapter is full of abbreviations, okay? And we don't use abbreviations, you know, for a lot of things in medicine, but we do use them a lot in the musculoskeletal system. And doctors use them a lot when they chart. So I threw this case study in, not really a case study, but I should say I threw this medical statement in so we could work through it, okay? So we have a 92-year-old LOL. LOL is little old lady, okay? NHR, nursing home resident, okay? BIBA, what do you guys think BIBA is? Brought in by ambulance, okay, for FTT, failure to thrive, okay? So she's not doing well. She's not active, she's not eating, she's not, you know, sleeping well, she's just failing to thrive. Okay, so we have a 92-year-old little old lady, a nursing home resident, brought in by ambulance for failure to thrive. Okay. CP, chest pain. Okay. NV, nausea, vomiting. With BR, BPR. Okay, and this one's a very interesting one. Bright red blood per rectum. So in other words, she is bleeding from her rectum. This poor lady's in bad shape. The patient is SP. SP means status post. So she had, okay, an NSTEMI, a non-ST elevation myocardial infarction. Okay, so when you see SP, or status post, that means she had a myocardial infarction in the past twice, in 1996 and 1997. Okay, with 4V cabbage. So she had 4 vessels. She had cabbage procedure done on 4 vessels in 03. Okay. CB, complicated by wound infection. And she complains of, CO complains of CP. What did I just tell you CP was?
Chest pain.
Chest pain for 3 hours. So finally we're getting to what the chief complaint is. Okay. So, but history is so important, and you figure 92 years old, she's had a long life, so she's going to have some pretty pertinent history. Okay. So the patient ambulates with an FWW, a front wheel walker. Okay. And is status post, okay, bilateral, total hip replacement. And fell yesterday, and I love 2 and 2. That means secondary 2, okay? Secondary 2, a syncopal episode. So she fainted, okay? And she LOC'd when she fainted. She loss of consciousness, okay? So this poor lady is in bad shape when we brought her in, okay? But this is something that you will see if you work in the ER. This will be how it is passed along from the paramedics while they are en route to the hospital, and the nurse is literally taking, or the medical transcriptionist is taking the history so that the physician knows what they're dealing with by the time they get there. It sounds pretty simple, but when you start using these on a regular basis, they'll just come to you naturally. Okay, so this is what it would have looked like had we written it out completely. So the whole point of the abbreviations is we can get a lot more written in a lot shorter time. Okay. All right, so let's talk about a medical statement. Okay, the orthopedist. What's an orthopedist deal with? Anybody?
Foot. Bones.
Bones. Yeah, the podiatrist deals with the foot. You're absolutely right. So an orthopedist deals with anything that deals with the bones or muscles, the musculoskeletal system. Recommended Mr. Shaw have an arthrodesis. Okay. What do you think that is? Arthro. We know what arthro is. Arthro is joint. Yep. He had a surgical repair of a joint to reduce pain caused from an ankle fracture he sustained years ago. Okay. Second one, Mrs. Diaz severed a tendon by accidentally walking through a glass patio door. Yes, it sounds funny, but people do it all the time. Okay. People can walk through doors. They forget that they're open. And, you can have a handful of stuff. It happens at picnics all the time. People think the door is open and they walk through it. There's a lot of old doors that aren't tempered glass out there, so it happens, okay? A tenorrhaphy was performed to repair the tendon. Rhaphy, surgical repair of the tendon, okay? An electromyogram can assist the physician in diagnosing muscular dystrophy. Okay, what do electromyograms measure?
CT.
That would be part of a CT, would help with that. You're absolutely right. But electromyograms measure, they send nerve impulses and they see if the muscles react. So say somebody was having trouble with moving their fingers. They can stimulate the nerves that would move their fingers. And if the fingers move, they know the nerves are still working and that it might be more of a joint problem, okay? So atrophy, we talked about atrophy, okay? What does trophy mean? Does anybody remember? It means nutrition, okay, or, normalness. Atrophy means that the muscles are no longer working right. It means there's a degeneration or a lack of nourishment. Okay. All right, girls, you guys have any questions for me?
I had a question about the discussion.
Yes.
Do we have to reply to other people or no?
Yes, same rules of engagement apply to the discussion. You do your original post and then please reply to 2 other student posts.
Okay.
Okay. All right. Well, ladies, I hope you all have a good week. I hope when I come back to report to you next week that my husband doesn't have coronavirus, but we shall see. So everybody have a great week and stay safe, okay?
Thank you. You too.
All righty. Bye, everybody.
Bye.
Bye.
Bye.